Our next guest is Graham Reynolds, senior psychologist at the American Institute for Cognitive Therapy. Graham's going to discuss microdosing, drug treatments for depression, and the millions of dollars invested into technology for these clinical trials.
Welcome to the show, Graham. How are you doing today?
I'm doing well. Thanks for having me.
So for people who don't know, what is microdosing?
What is it?
Microdosing is a sort of new phenomenon that is coming out more recently. It's becoming more popular in places like Silicon Valley. And this is a procedure where people are taking very, very small doses of psychedelic drugs, things like LSD, mushrooms, and things like that. And it's really early on. This is not yet in the phase of clinical trials. It's sort of experimental stuff. It's kind of underground. It's still an illegal procedure, so it's certainly not something as a clinical psychologist that I would be recommending to people. But I think even within the last 6 weeks or so, they have just now started doing clinical trials on this and looking at, might this be effective?
So we don't know right now. The jury's still out on that.
We don't know. But for other drugs, it's really interesting. We are actually starting to look at, can we use what would otherwise be considered drugs of abuse to treat things like depression for ketamine usage, for example? Or can we treat PTSD with MDMA? Can we treat anxiety and depression with psilocybin, the active drug compound in psychedelic mushrooms? And these things are actually starting to move to clinical trials at this point.
What do you think about that, Lindsay?
I was just thinking that could... Well, I was going to ask Graham's perspective. Do you think, even you're working with children, adolescents, adults struggling with a variety of issues, do we want to take it to that level in leveraging some drugs to improve a way of life?
Absolutely. I think that's a consideration that always has to be talked about. Me as a therapist, I'm not prescribing medications, but I often will work with the medical providers. And what we know from research is that a combination often of psychotherapy, evidence-based practices like cognitive behavioral therapy, dialectical behavior therapy, the type of work that I do at the American Institute for Cognitive Therapy, plus medications can be really helpful. These early trials with things like ketamine, for instance, it's not sort of the magic cure for depression. This is really early on. Basically what they're doing is administering doses to people who are acutely depressed, maybe even acutely suicidal, and they're finding that they're getting some relief in the short term. Ideally, once we can assess whether these things are safe, that's always an important consideration. Is there abuse potential? If it's getting through phase 3 of drug trials, though, maybe that can be used as an adjunct for treating depression for people who are otherwise not being able to get the help that they need through traditional methods.
And could it lead to addiction?
Absolutely. One of the issues that we face with some of these drug trials is just by the very nature of doing these clinical trials, we have to look at pure samples of people with, say, PTSD. But if we look at the data, we know that as many as 1 in 5 people with a PTSD diagnosis also have comorbid substance use issues. So these are really important considerations to think about. Should we be giving these drugs of abuse to people? How are they going to be regulated? How is it going to be controlled? I think these are all important questions that we have to ask. But given just the sheer numbers of people that are struggling with these things, we have 40 million adults in the United States who are diagnosed with an anxiety disorder. We have 16 million people in the United States who are diagnosed with depression. And this is a huge financial burden, too. I mean, we're talking hundreds of billions of dollars in terms of the economic cost. Depression is one of the leading causes of disability in the United States. So this is equaling a lot of missed time at work and just the interpersonal and, on a personal level, the struggles that people are facing. We kind of have to ask these questions. How can we best address these issues? Traditional methods, we know, just may not work so effectively. SSRIs, the selective serotonin reuptake inhibitors, the very common prescribed drugs for depression, maybe work for 30 to 40% of people.
That's it?
That's it, yeah. If we add in therapy, as I said before, that can increase the efficacy, and what we know from therapy is that can make it more long-lasting. At 1 year follow-up, people tend to do better with the therapy aspect of things, but there are still these populations that are being missed. The FDA is now fast-tracking and designating some of these drugs. So, for instance, the ketamine treatment for depression, MDMA treatment for PTSD, they have considered them what are called breakthrough therapies, meaning that they are treating a really serious issue and that they are shown to be pretty effective, at least in these early trials. And so what that can do is get this out to market as early as 3 years sooner than what otherwise it might take to get a drug approved.
So let's talk about cognitive therapy. What is that?
Cognitive therapy has been around since the 1960s, 1970s. It was developed by Aaron Beck and sort of expanded on over the last 20 to 30 years. This is a practice that has been shown time and again to work. It is effective at helping people deal with things like depression, anxiety, anxiety, bipolar disorder, schizophrenia. I mean, you name it, across the spectrum. There are research studies, randomized controlled trials that show that this can be effective and it works for people. The premise is we want to help people think differently. There's this idea that if you can change how you think, or even change how you respond to your thoughts, you can maybe then start to feel better, and ultimately...
That's exactly what our last guest says.
Yeah.
That's
Did you
right.
notice that?
I saw that.
There's a theme there.
It's really about changing what you think, and that can change how you feel and change what you do. So from the cognitive and behavioral standpoint, it's both cognitive and behavioral. We want to look at what are the thoughts you have, what's your running dialogue. If you're feeling depressed, what kinds of things go through your mind? How can we challenge those things? How can we address those types of thoughts, get you to change them, and then do things that are different, do things that are in line with your values to make it, better for you to live your life.
Yeah, sometimes it takes just changing behavior to change the results.
Absolutely. Early on it started out as cognitive therapy, and it has now become cognitive and behavioral therapy. And my bias, I think, is because we need the behavioral piece. We absolutely need to be doing both of these things. And there are so many different approaches that work, so many different ways to go about doing this. I would encourage people to look at what is effective for you, find out the treatments that work, and start pursuing some of these options if you're really struggling.
Some great tips.
Those are great tips. Yeah, because this is something that touches every single family in the United States,
Absolutely.
considering the statistics that we have. Especially shocked me the anxiety statistic, because you hear a lot about depression, but you don't hear as much about anxiety.
Sure. I mean, I think there is the big cost with depression, and we can put the number in the hundreds of billions of dollars on the economic cost, but with just the sheer number of people that struggle with anxiety, this is a common thing. I mean, 40 million people, chances are you or somebody you know struggles with this on an almost daily basis, and there are ways of getting relief. That's where some of these...
So there is a light at the end of the tunnel, because a
Yeah.
lot of times with a lot of these conditions, it's like, oh, it's genetic, it's something, I can't do anything about it, I'm embarrassed to, admit I have a problem.
Right. There can be a lot of stigma around this. I think there is a genetic component. We can't necessarily change that, but the evidence shows that going through these types of therapies, doing this kind of work, can be incredibly effective at making change in people's lives.
He's a good spokesperson,
This is
right?
awesome, yeah.
Looks like
Graham.
we have a new spokesperson for the American Psychology Association, or what?
Really happy to
Yes.
help.
Graham, thank you so much for joining us today.
for
Thank
having me.
you.
Absolutely.